So I oversee our Plan4Health project strategies in Columbus, which means I coordinate all the moving parts in the day-to-day activities, connecting the dots between the things we're doing and other projects that might be going on in the city or by our partners, and then also reporting out and connecting our work to our Chronic Disease Advisory Board, which is the cross-sector coalition that's guiding our work through Plan4Health. All of our project strategies focus on increasing access to active transportation, and we're doing that in 4 main ways. We're doing a health impact assessment on Connect Columbus, which is our new long-range multimodal transportation plan for the city of Columbus. We're also conducting a strategic plan for our Central Ohio Greenways to enhance our regional trail network, to increase access and connectivity, create new community partnerships, and add programming to the trails to get more people to use them. We're implementing Safe Routes to School programming and other interventions to get more children and students in the Columbus City school system to walk and bike to school. And we also are implementing a new bike-friendly business program to increase the number of businesses that have policies and amenities that support active commuting by their employees. First, I think it's mainly just added awareness among both the planning and public health professionals and decision makers in the city. And I think having this high-profile initiative, especially being led by a national organization like American Planning Association, had a lot to do with that. The other thing is it's really strengthened our relationships with our partners and helped us build new ones. And anybody who's tried to do this work will tell you that it all comes down to relationships. You know, projects might end, but relationships last. Relationships are what lead to the institutionalization of this way of thinking, of integrating public health considerations into everything we do as a city. So it's interesting, because of my job, I'm kind of both a planner and a public health professional, and I wear both hats. And depending on the room that I'm in, I might be the planner in a room full of health professionals, or I might be the health guy in a room full of planners and engineers. So depending on the room that I'm in, I'm always usually translating. I like to say now I'm bilingual in planning and public health, and I'm usually translating for one side or the other. And the other thing that it's done that I've noticed is it's really ingrained and reinforced to me that planning is about people. We all find ourselves planning for different purposes, whether it's economic development or environmental protection, but health is the most fundamental purpose of all of that, because what we're really doing as planners is helping design our human habitat. And if our habitat isn't supporting our health, then what's the point? We've designed our strategies to take advantage of the timely opportunities that presented themselves at the beginning of the project period to align our strategies with other things that were going on. So the work we've done to support Connect Columbus and Central Ohio Greenways will have a lasting impact as those plans get implemented over the next several years. And we've also designed the strategies to do the work that we just already wanted to be doing but didn't have the capacity to do. So our Safe Routes to School and bike-friendly business programs are now just part of our work plan. But what Plan4Health allowed us to do was take a lot of time and resources during this project period to build the tools and processes that now we have and we can just continue to do. So it's interesting. 2 different surveys. One survey was for our 2014 Recreation and Parks Master Plan process. The number 1 most liked feature of our whole park system, people said, was trails. And the number 1 thing they said they wanted more of was trails. In a completely separate survey for our Central Ohio Greenways Economic Impact of Trails study, people said that the number 1 thing they liked most about the trails is connectivity. And they said the biggest thing that needed improved was connectivity. So that tells us 2 really clear things, that we need to build more trails and we need to build more safe routes to trails. And it only makes sense that, we know parks and trails, they provide value to the communities that they're in. They have very important economic and environmental benefits. They attract and retain talent, and we know that they really have a strong impact on the health and vitality of the people who use them. So that's why we're making a strong concerted effort to increase access, and more importantly, increase equitable access to these really valuable resources in our community. And the Scioto Greenways project is a great example of that.